Hello everyone, I'm Marco Romanato, a PhD candidate from the University of Padova in Italy. And first of all, I would like to thank the scientific committee that gave me the chance to present our work, which is entitled The Evaluation of Impact of Different Scaling Approaches in the Model-Based Muscle Forces Estimation during the Locomotion in Parkinson Disease subjects. So, Parkinson's disease is a progressive neurological condition which affects almost 6.5 million people around the world, and it is characterized by motor and non-motor symptoms. Among the motor symptoms, we have changes in the normal walking cycle and in the electromyographic signal. Well, the electromyographic signal is not representative for subject strength, so we introduce musculoskeletal modeling to non-invasively estimate muscle forces. And with this work, we want to seek the most appropriate scaling approach for the musculoskeletal model. With that in mind, we enrolled five control subjects and five Parkinsonian patients, and we processed the motion capture data along with the ground reaction forces and EMG signals with two different pipelines involving linear scaling in OpenSim and muscle optimizer scaling always in OpenSim in order to obtain inverse kinematic static optimization, inverse dynamics, and the muscle. So once we obtain the simulated activation by the static optimization, we compare them with the experimentally acquired EMG signals and we evaluate the accuracy of the models. Then we process the data with the CineMS and other OpenSim toolbox, which is driven by EMG signals in order to estimate muscle forces more appropriately. And the result of muscle forces obtained with CineMS on the tibialis, rectus femoris, gastrocnemius lateralis, and vastus lateralis show that the model, which is linearly scaled, helped to highlight differences between the populations in a higher range of the gait cycle. To wrap up, muscle tendinous geometry seems to be improved with the muscle optimizer tool. Indeed, with when we compare it with the linearly scaled one, statistically significant differences concerning force amplitude and peaks are highlighted. Limitation of the study should be acknowledged. We need to develop an ad hoc experimental setup for the gait analysis acquisition that takes into account the number of experimental EMG channels and a larger number of trial per subject in order to obtain a good model prediction. Thank you for your kind attention, and if you have any question, feel free to ask.